Perfect. Okay. Can everybody hear me okay? All right. Good afternoon. Today, as we come together to discuss an incredibly important topic, I am grateful to be joined by Monroe County Legislator Justin Wilcox, Monroe County Commissioner of Public Health, Dr. Michael Mendoza, and Adam and Mary Beth Gillen of Brighton. As I have said many times, the opioid epidemic is one of the largest public health crises to hit our community in my lifetime. And that was before the COVID-19 pandemic hit. Now, our community faces two once-in-a-generation public health crises at the same time. And while the COVID-19 pandemic has been devastating to so many people in our community, it has also dramatically impacted people who struggle with addiction. Addiction thrives in isolation. Being alone in quarantine or socially distanced from family, friends, and support systems can be devastating. And the numbers tell a tragic story. So far this year, Monroe County has had 65 fatal opioid overdoses compared to 47 at this time last year. So far this year, Monroe County has had 354 non-fatal overdoses compared to 286 at this time last year. And in March, April, and May of this year, we recorded nearly 60% more fatal overdoses than during the same period in 2019. Those numbers make it clear that the COVID-19 pandemic has taken a heavy toll on many people struggling with opioid addiction. So it's now more important than ever before to address the ongoing crisis. We must aggressively pursue measures that will reverse this disturbing trend and help our community overcome this epidemic in the long run. My long-term pledge to create an opioid response team stands. Last month, the county legislature approved my proposal to create an addiction services director, and we've begun the process of putting together a team, the size and scope of which will match and rival the size and scope of the problem that we face. The team will operate within the Department of Health in close collaboration with the Office of Mental Health. And we will have more details on the full scope of this team in the days to come. But today, I am pleased to welcome Legislator Justin Wilcox, who today is introducing legislation that will raise awareness of an emergency treatment for opioid overdoses, and I am confident will save countless lives in our community. So with that, I'm going to welcome up my partner in the county legislature, Legislator Justin Wilcox.
Good afternoon, and thank you, County Executive Bello. As you noted, the numbers tell a tragic story. Before COVID-19, we were facing a serious opioid epidemic in our community. Over the past several months, it has become even more devastating. People are overdosing and dying at a significantly higher rates than last year. That is why we urgently need to increase awareness and distribution of Narcan in our community. Narcan is an emergency treatment that, if administered at the first sign of an overdose, will lessen or reverse the life-threatening symptoms. Narcan is relatively simple to administer, and New York State pays all or most of the patient cost. For the same reason we have first aid kits, anyone who has an opioid medication in the house should also have Narcan on hand, just in case. That's why I'm introducing today, that's why the legislation today that I'm introducing will require every pharmacy in Monroe County to dispense at least one dose of Narcan to every individual picking up an opioid prescription, unless the individual opts out in writing. The legislation will ensure that pharmacists at least have a conversation about Narcan with their clients. This will increase awareness of this potentially life-saving treatment. It will eliminate any embarrassment over having to ask for it, and it will put Narcan in places where, God forbid, it might be needed to save a life. Thank you, County Executive Bello, for your support of this bill and for continuing to make the opioid epidemic a top priority, even in the midst of this pandemic. I'm also moved by the support today of Adam and Mary Beth Gillen of Brighton, whose tragic experience with opioids touched me deeply. Their 9-month-old daughter, Daisy, died after a family visit to a neighbor's house, where she consumed an opioid pill dropped on the floor. The measure I'm introducing would not have saved Daisy's, but it will save countless others. In her honor, The Gillans are advocating for real action to reduce the number of opioid-related tragedies in our community. I urge my colleagues in the Monroe County Legislature to do the same and vote yes to this legislation. Now I'd like to invite Adam and Mary Beth to say a few words.
We'd like to thank Adam Bello, Justin Wilcox, and Monroe County for working on this legislation, proposing a county law that will save lives as a productive tool against the opioid epidemic. Any event like this is emotional for our family. One of our many goals since learning that Maisie died from an overdose due to negligent handling of a prescribed but lethal dosage of methadone was to find ways that prevent this from happening to other families.
The studies and data show that Naxalon or Narcan is an effective neutralizer to an overdose. When you are prescribed an opioid, you will have the opportunity to get Narcan. Hopefully, you will also understand that you are carrying a loaded weapon and should treat it as such. We visited Maisie's gravesite after learning that this event may take place. I wanted to tell her that I hoped we were doing something good in her honor and that she may have to wait to meet some friends because this action by the Monroe County Legislature will save lives. So regardless of how someone overdosed, they can be saved and they can spend more time with their loved ones. In our circumstances, these actions today would not have saved Maisie. Tragically, her death trap was set days before our visit, but our family will continue to be present and vocal to demonstrate that the opioid epidemic can and will have devastating consequences outside of prescribed and illicit opioid use. Going forward, as people receive opioid prescriptions in Monroe County, we hope that in addition to a life-saving dose of Narcan, a byproduct of this legislation is that more care will be taken in handling that medication, because while the opioids are helpful, there has to be better education about how dangerous they can be when mishandled. We're activists on a specific issue that ripped our family apart: poison control and medication safety. We hope today is an example that activism can create some positive outcomes, and for other activists to keep pushing forward. Change is a long, hard road. Ultimately, there is no final destination. There are always opportunities to be better and do better, like we are today. That said, there are moments to stop and take in the view. So today we will say, look how far we've come. And tomorrow I will wake up and say, look how far we have to go. Thank you.
Thank you, Adam and Mary Beth, for sharing your story. In the face of the unimaginable and devastating loss of Maisie, your tireless work to advocate for change is inspiring to all of us and to everyone watching here at home. I can only imagine the courage that it takes to stand up here in the memory of your daughter to save lives in our community. And we're all very grateful for you coming here today and coming forward to do this. And in honor of your daughter, Maisie, we are going to name this Maisie's Law to make sure that she is properly acknowledged and remembered. In her memory, we're going to save lives here in Monroe County. And I am going to pray that our actions today and in the future will provide some comfort as we work to address the very real dangers of opioids in our neighborhoods. And I also want to thank again County Legislator Justin Wilcox for proposing and coming up with this idea, this common sense legislation. Legislator Wilcox has been a leader in the Monroe County Legislature when it comes to issues protecting families and children in our community, whether it be the opioid crisis or early intervention. He's always there to stand up to tell us how we can protect our people. And now I'd like to invite Dr. Mendoza, who is joining us via Zoom, to say a few words on the support of the legislation.
Good afternoon. It's great to be here with all of you today. First, I want to also thank Adam and Mary Beth Gillen for having the strength and the courage to share your story and for allowing us the privilege of using Maisie as our collective inspiration to do something positive for the rest of this community going forward. I also want to thank our County Executive, Adam Bello, for your leadership and commitment to fighting addiction in Monroe County. Our county executive has made this a top priority since taking office, and I look forward to working with him in the months and years to come to continue the process of progress we've made to date. And last, I want to thank County Legislator Justin Wilcox for sponsoring this measure, for taking the leadership here within the County of Monroe to enact a common sense law that will hopefully make a huge difference in preventing these tragedies going forward. Monroe County, like so many other communities, both throughout New York as well as across the nation, has been battling the opioid epidemic for years. And we also know that we cannot simply rest on our laurels. We know that the opioid epidemic requires of us to adapt, to think of new ways to approach this crisis, and to introduce new ways of attacking this years-long problem. Locally, we know that the majority of overdoses occur in residential or private settings, very often in someone's home or in a friend's home. And we also know that the prompt administration of Narcan can be the difference between life and death. The legislation proposed today by Legislator Wilcox will provide for a Narcan prescription for anyone who receives a prescription to an opioid medication here in Monroe County. And although the vast majority of those who are prescribed opioids take these medications safely and appropriately, we also know that anyone taking these medications is at some risk for an overdose. And we also know, unfortunately, that when opioids are present in the home, that anybody in the home can also be a victim, unfortunately, to accidents that do sometimes happen. This simple measure could go a long way towards saving lives and lowering the number of fatal overdoses here in our community. And so I am hopeful that by enacting common sense measures like the one we are introducing today, that in conjunction with broader efforts addressing the risk factors and access to treatment for opioid use disorder, that together we can learn from each other and continue to address this major public health epidemic. And with that, I want to turn it back over to the county executive.
Great, thank you, Dr. Mendoza. And this is important. The legislation being proposed today, Maisie's Law, will be impactful. And while the steps we're taking today are just the beginning, they are critically important as we tackle this scourge that is tearing families apart and destroying lives throughout our community in every corner of Monroe County. And so with that, we can take some questions. I just want to remind our reporters that we have County Legislator Justin Wilcox, Dr. Mike Mendoza, Adam and Mary Beth Gillen, and myself.
Okay, we're going to start with Brian Sharp at the DNC, and he will be followed by Rebecca Pack from WROC.
So, thank you for the time today. I'm actually coming at this with not a lot of knowledge on could someone explain what is the current policy? And just sort of walk through, do we know the supply is there, or who would pay for it, and when this takes effect?
So I could say a few words about the process. So in New York State, for years now, we've had the ability for, through a standing order to be able to get naloxone from a pharmacy without a prescription. And we also know that hasn't quite hit the mark. We need to do something more to expand access, primarily through our pharmacies, to ensure that Narcan is available throughout the community. And so in this measure will put into place a process so that individual people will have to opt out of receiving the naloxone. And it is like any other medication currently, one that would have to be obtained, with the appropriate copay and so forth. But through the New York State Department of Health, we have the naloxone copayment assistance program, which allows all pharmacies to bill up to $40 of an individual's copay to the State Department of Health. So that effectively makes it free of charge to the vast majority of people in our community. And then for those who do not have insurance, we'll continue to offer Narcan free of charge here through the health department.
You had a question about when this would take effect. Obviously, it's got to go through the committee process first, and then it'd have to go through the full legislature. So that was highly dependent on how fast we can move this through committee and get it passed by the legislature. But it would effectively, it would take effect almost immediately.
Okay, thanks, Brian. Rebecca Pack from WROC is next, and then Andrew Bannis from 13 WAM.
Yeah, thank you so much for speaking with us all today. I guess my question is for Dr. Mendoza, as a medical professional, I'm sure you've seen a lot of things we haven't. So how does it feel to be taking this step and making this new initiative?
Well, this is work that's important, and I take care of people with opioid use disorder. I know the struggle that they go through. These aren't nameless, faceless people. These are our mothers and fathers and relatives and friends and neighbors. And this measure, if it were to come to be law, would go even further to hopefully reduce the stigma around opioid use disorder, the stigma around opioid medications, and frankly, start to normalize the presence of naloxone across our community. We should not be viewing this any differently than we view epinephrine for food allergies or AED kits to prevent cardiac arrest. This is just good community proaction to prevent fatalities.
Thank you so much.
Okay, Andrew Dennis from 13 Lamb, followed by Patty Singer from Minority Report.
Hey, Dr. Mendoza, this one's for you. Hope you're doing well. Wanted to ask actually an off topic about what we've seen in our area the past few weeks. We know Memorial Day, and then there have been several protests throughout Rochester. Coming at it from the COVID-19 standpoint, have you seen a spike in numbers, or do you anticipate we might?
Well, I wouldn't be doing my job if I wasn't looking. And so I'm looking very hard to find those spikes. And following Mother's Day, we found some isolated spikes through our contact tracing and case investigation. We've heard stories of individuals who very likely contracted the infection from gatherings. But thankfully, we are not seeing the major surges that, frankly, I'm worried about. And there's no public health professional in this country that is looking at these gatherings and not worrying a little bit. But I think we all take some level of solace in recognizing that the vast majority of people are using masks, are taking whatever precautions they feel they can and need to go about what they also believe is very important. So I am waiting with bated breath. We are still looking at the data. The tests that would have come in following the first weekend of the Black Lives Matters protests, we should start to see those results coming in, any day now, really. But right now, there's no indication of any major surge. So for now, it's cautious optimism.
Thank you. I have a quick follow-up if that's okay too.
Go ahead.
For Dr. Mendoza as well, we know that some industries require testing, like hair salon owners or barber shop owners, but there's also many that don't, restaurants or even some healthcare workers. Do you think this should be something that is across the board? Everybody who's working with the public should be tested, or do you think specifically those ones were singled out for a reason?
Regardless of what the legislation says, I think the better part of caution is to test. That's what we want to do. And whether it's required or not, I think it's important to test. And I'll leave the requirements and the regulations to those who make laws and enforce them. But from the health standpoint, anybody who's at risk, frankly now, has access to get that test done. And the frequency of which and the details of that really ought to be taken on a case-by-case basis. But anybody who's at risk, and certainly, initially the barbershop employees and the salon staff, that makes sense. But certainly there are going to be other people who come down the pipe who are going to be equally at or at greater risk. So for anybody who's at risk, I want to encourage you to get tested.
Thanks, Dr. Mendoza.
Okay, Patty Singer from Minority Reporter, and then Dave Andriata from City Newspaper.
Hi, thank you. So how would this legislation affect the illegal use, the street use of opioids, people who think that they're getting an opioid on the street and it's fentanyl? So, I mean, I understand the need to have this in homes, but often overdoses are taking place on the street or in abandoned homes. What is this legislation going to do to help get Narcan distributed into the areas of our community that see a lot of street use of opioids?
Well, we know through the data, because we have the access to the data on every overdose that occurs in this county, that the vast majority, I want to say over 75% of the fatal overdoses occur in private residences. So that's not to say obviously that 25% or so do not, but having the access to naloxone in a residence just does that much more to get it out there into the community. And to the extent that people will take it from home into the streets or into the areas where they're using, expanding access to Narcan can only be a good thing.
Right, just a quick follow-up, but that has to assume that someone's getting an opioid prescription, so they'll be offered that at the time. And obviously there is a need for that, and that is very appropriate. I don't want to minimize that. But for people who may, I know there's naloxone all over the community, but for people who just may not be seeing that that's a need for them, how will the legislation help with that use? Or even somebody who may be in someone else's home, they don't know there is naloxone there.
Well, that's why this is just a small piece of a larger effort that we have to undertake as a community, and that we have been for years. You know, there is no one thing that we've done that will be the end-all be-all answer. This is an important piece of a larger community solution. I think it's an important piece because, you know, we know that 75% of people who have an opioid use disorder began with a prescription opioid. So at some level, they have access to medications. And if we can provide access to Narcan in their homes, you know, given that Narcan is harmless, and now hopefully, you know, even more easily accessed, I do think that this can only be a good thing.
Thank you.
Thank you, Patty. David Andreata from City Newspaper.
Hi, thanks for can you hear me? Yeah, thanks for taking my question. This is for Legislator Wilcox, possibly for Monroe County Executive Adam Bello. Was there any consideration given to legislation that could be crafted or enacted regarding packaging and storage of opioids, or is that just out of the jurisdiction of the county?
That's a great question, David. That's something I certainly did some research on. It does seem to be out of the jurisdiction of the county, and certainly something we can look at the state level. It's something I was looking at when I was working for Assemblywoman Romeo, and something I certainly would consider doing on with the state legislature.
Thank you.
No follow-up? I think we're all done.
All right, thank you very much for all of you joining us here today. Again, I want to thank Adam and Mary Beth. I want to thank Legislator Justin Wilcox for his leadership on this issue. I want to thank Dr. Mike Mendoza for his expertise and his help in crafting this. And I again want to thank the county legislature for taking up Maisie's Law, this incredibly important step in protecting people throughout our community from the opioid crisis, opioid epidemic that is literally taking lives throughout our community. And this is just the first step of many that are going to be rolled out over the next several weeks as we seek to address the opioid crisis that has been severely impacting this community for many years. So thank you all very much, and I look forward to continuing this conversation.